All right. Good afternoon, everybody. Thank you so much for being here. A couple of housekeeping things before we get started. As you heard, we are recording this session, and there are people who are participating live by Zoom. So we want to be respectful of that. We've all been on Zoom calls that are impossible to hear, so we'll be sure that we're speaking into the mics. And when the time comes at the end for questions from you, we'll ask you to wait until a mic is available so that they can hear your questions as well. My name is Kathleen Carroll. I'm a longtime journalist and press freedom advocate, and I was lucky enough to be one of the judges for the Goldsmith Prize for Investigative Reporting this year. And so it's a great pleasure to be here with the 6 journalists representing the outstanding bodies of work that were selected as Goldsmith finalists, which is, as you know, a huge honor. We all got into this work because we believe that journalism can make a difference. And it's kind of hard to hold on to that belief sometimes, and as the profession is challenged in every way that you can imagine. But what you'll hear about today will underscore just how true it is that journalism can make a difference. Newsrooms, large and small, are devoting resources to the kind of investigative work that impacts real people, exposes flawed policies, flawed execution of policies, maybe no policies at all, or things that can be remedied because of the investigative work of journalists like these. Now, here's how we'll unfold today. Am I still on? No? Yes? Yep. Okay, good. Sorry. The journalists will introduce themselves, we'll go down the table, and they'll each one talk a little bit about the work that's brought them here. And then I'm going to ask them, each of them, some questions about some particular aspect of their work that was very riveting or strong. And then we'll take questions from you all. So be ready, and be ready to be inspired. Jennifer, we'll start with you.
Thank you, Kathleen. I'm so pleased to be here today with you. My name is Jennifer Gollin. I work for the San Francisco Chronicle, where I'm an investigative reporter. We produced a year-long series, my reporting partner who's here today, Susie Nielsen, and I, that showed that fatal police pursuits are killing an unprecedented number of people. We found that more than 550 bystanders have been killed over 6 years, and that officers are rarely held accountable for these fatal pursuits, even when they initiate reckless pursuits that kill innocent people. We found more than 3,300 people had died over a 6-year period, and that the federal government does not comprehensively count these deaths. More than 600 deaths are missing from their records.
I'm Katie Roosh. I am a reporter with the Investigative Reporting program, and we published this series in partnership with the San Francisco Chronicle. We love them. This series is about a secret system of legal settlements that whitewashes and buries misconduct of police officers in the state of California. These agreements had never been widely reported on before. And we found that at least 163 departments in the state of California had executed these agreements that whitewashed and buried the misconduct of police officers, allowing them to get jobs at other police agencies. Sometimes some of these officers had multiple agreements allowing them to leave. In addition to having their records whitewashed, many of these agreements included cash payouts and sometimes lucrative disability pensions.
Hi, my name is Chris Weaver. I'm a reporter at the Wall Street Journal. We did a project examining how giant insurance companies abuse the Medicare system using basically the raw patient level data that showed ways that they sort of go behind the scenes to add diagnoses that make people look sicker on paper and ultimately trigger higher payments, taxpayer funded payments from Medicare. And then kind of on the flip side of that, when people need, more expensive services in Medicare, find ways to deny it or in some cases kind of force them out of their plans altogether.
Hi, everyone. My name is Shoshana Walter. I'm an investigative reporter for the Marshall Project. Our series focused on how hospitals across the country routinely drug test pregnant patients who come in to give birth using urine drug screens that have very high false positive rates, up to 50%. and are extremely prone to error and misinterpretation. We found that families have had their newborns forcibly removed from them due to drug tests triggered by poppy seeds, by heartburn and cold medications. Even the most commonly prescribed blood pressure medication for pregnant women have triggered positives on these drug tests that have led to child removals and investigations. Yeah, I'll leave it at that.
Hi, everybody. I'm AJ Legault. I'm an investigative reporter with Care 11 Television in Minneapolis, Minnesota. And along with my producer, Steve Eckert, who's here in the room with us, we set out to do, in essence, the age-old journalism process of following the money inside the addiction recovery business in Minnesota. And Minnesota really has had this sterling reputation for, and lots of people come from all around the country to go through addiction treatment there. And what we found was systemic exploitation of people that were not getting the treatment that taxpayers were paying for. The vast majority of our focus was on Medicaid dollars, and what we were able to show is that tens of millions of dollars was being billed to Medicaid for services that people were simply not receiving.
Hi, I'm Dave Phillips. I write about the military for the New York Times. The military over the last couple decades has spent hundreds of billions of dollars trying to understand and treat PTSD and brain injury. And we realized and reported on this year that they had completely missed something huge, which was that a lot of the brain injury and PTSD, maybe even most of it, was coming from injuries caused by people repeatedly firing their own weapons. We discovered that the military wasn't studying that, certainly was doing nothing to limit it, and oftentimes was punishing the people who came down with these symptoms. After we realized that that was happening with blast exposure, we also expanded our coverage out and realized that it was also happening with people who were repeatedly exposed to whiplash on high-speed boats in the Navy, and also fighter pilots who are literally slingshotted off of carriers over and over in their careers. And perhaps the most troubling thing is that because these injuries take many exposures and years to develop, it was the senior people in the military, the people whose job it was to recognize and deal with this injury, who oftentimes were most affected. And so this injury has been going on for years.
So a lot of problems identified by these reporters.
Real sunny bunch.
Yeah.
And one of the things we want to talk about is how they did that work. So Christopher, let's start with you, because there was an enormous amount of data work that you all had to do to just understand the records. And maybe you could talk a little bit about that.
Yeah, that's right. So, our team had done a project looking at traditional Medicare like a decade earlier, where the kinds of abuse is like a doctor billing for a whole lot of maybe unnecessary tests or something like that. And on some level, that's just like counting up the stuff the doctor did. With Medicare Advantage, the data needed to kind of look behind the scenes and see how these companies are operating was a lot harder to get. And the process of using it was just like a lot bigger, like a lot more data, because the payments are driven at the population level. Basically, like the sickness of the kind of illness burden of the members of each insurance plan, essentially. So to get the data, that was like the first huge challenge. We had to go through this really cumbersome process that we think we're the first media organization to undertake, where we proposed a research project, got approval from an institutional review board, and got Medicare to essentially deem us like researchers for purposes of an exemption to the main federal privacy law. So we could access patient level data for everybody in Medicare. So that amounts to essentially every prescription filled, every hospital stay, every doctor's visit. And then we could use that to start to reverse engineer the Medicare Advantage payment system and kind of find out where the kinks were forming in the system. When we got it, as my colleague Tom said, it was kind of like the dog that catches the car, where basically we've gone through this like 9-month process of finagling this thing out of the government, and then we're looking at this massive haul of like 10 billion records 10 billion services a year, and then like kind of all the detailed line item records describing, all the little things that went on during each doctor's visit or hospital stay or whatever. And we had to do the cumbersome work of, for the kinds of stories we wanted to do, looked at things like the mechanics of how insurers went behind the scenes to add diagnoses to people's records to get more money. So we needed to calculate essentially the incremental value of each individual new diagnoses that they added through different methods, like sending a nurse to people's houses to run probably needless screening tests, or reviewing charts and kind of pumping new diagnoses into their Medicare records on the back end. What we found was that the insurers had essentially extracted an extra $50 billion from Medicare by adding diagnoses that no doctor or hospital had treated over a 3-year period, among other things.
That's a number that might get the attention of the folks that oversee Medicare. Shoshana, your work had some really shocking findings of people who were, babies ripped away from their mothers right after they were born. I wonder if you could talk a little bit about how you found people who had this terrible experience, and how you're following what's happening to them since. And then we'll talk a little bit with everybody about what's happening today.
Absolutely. Yeah. I mean, one of the challenges in reporting this story is that there isn't a source of data. Even the way that childbirth is billed on the insurance level, it's impossible to tell how many women or birthing people have been drug tested. And there's no child welfare records, medical records, they're all confidential. It's impossible to actually request these records via public records requests. And in some states, you can even be charged with a crime for sharing child welfare records with people who are not a party to the case. So there were real risks involved for many of the women that I spoke to for this story. And finding them was just, it was like a needle in the haystack a little bit. I scoured social media. There were women who made TikToks of just talking about how shocked and perplexed and traumatized they were to go to the hospital to give birth. They bring their newborns home, and now they have a CPS investigation. There are people who posted about it on Instagram and Facebook. I joined Facebook support groups for people with open child welfare investigations whose children are in foster care, and there were a lot of women who sought support via those routes, and also a lot of medical providers, doctors, nurses, hospital social workers. There were people working in the system who were really distressed about what they were participating in. One of the findings from the story was that hospitals are using these screens that have extremely high false positive and error rates. And then no state requires hospitals to confirm those test results with more definitive methods before reporting the results to child welfare authorities. So some hospitals that were even pursuing confirmation tests that turned out this woman was not positive for illegal substances were totally horrified to find that their patients continued to be placed under investigation. Sometimes their children were still removed from their care, despite proof that these women had actually not used substances during their pregnancies. So it was a real challenge to find people who were able to talk for the story, and it took a great deal of time and care to make sure that people were making informed decisions about their participation in the stories, that they understood that there are risks involved, potential retaliation from child welfare authorities, or even in some cases, criminal charges for sharing records and verifying information. And some medical providers, also shared patient information, put me in touch with patients, sometimes in peril of their jobs.
Thank you. Dave, you have covered the military, and particularly the impact of war on the fighting men and women for a long time. But it'd be interesting to know how you decided to focus on this particular set of injuries. And as you read the work, you can kind of see the thread being pulled through. You can almost sort of follow your reporting as you discover new things. But tell us how it first got started.
Accidentally, which is a lot of good stories get started that way. I see a lot of nodding here. We got a random call from an artillery guy who came home from a secret mission to Syria, and their artillery could fire 15 miles. They never saw the enemy, even though they fired thousands of rounds. And he said, man, everybody I went there with is a mess. We can't sleep. We're depressed. A couple of my friends have died by suicide. Can you write about what the hell's going on? And he thought it was moral injury. Just us knowing what we had done is causing us to fall apart. And when I started talking to the guys that he served with, I ran into a big problem, which is that most of them were not morally bothered at all with what they had done. But they still couldn't sleep, couldn't hold down a job, were depressed, having panic attacks, couldn't understand why. And they'd never seen the enemy. So what had happened? The only thing that had happened is they'd been exposed to thousands of blasts of firing their own cannon. And now, if you read the cannon's field manual, that's perfectly fine, perfectly safe, no problem. You can show up with every single symptom of a brain injury after that type of deployment, and they'll say, well, you don't have a brain injury because no one hit you on the head, you were never exposed to a bomb blast, anything like that. And so it was clear to us that it was happening. And we said, okay, where else is this happening? What other weapons? How are people missing this? Why? And that turned out to be like an 18-month-long answer process that basically covers the whole military.
Yeah, this work is always so painstaking. I hope people appreciate that. Katie, you work at the California Reporting Project at Berkeley, right? And you had a lot of collaborators with this, but you also spent many years working on this investigation. And I wonder if you could take us through one of the cases, one of the officers, because and I hope you will all read the pieces. There was opposition at absolutely every step in every case that you reported on, you know, from every police chief, every mayor, the state of California, the labor unions, absolutely everybody. So how did you break through so many times?
I pride myself on being very persistent in all avenues of my life. And that's what this story required. We worked on this investigation, my partner, Casey Smith, and I, for 5 years. Yes, I know. If we all could be so lucky to get that much time, but we were. And the reason it took 5 years was because of the confidentiality provisions and the layers of secrecy that we encountered at every step. For one particular officer, my reporting partner, Casey Smith, discovered this officer, Joe Arjanian, in 2020. We discovered him. We got one of these agreements that was really clear about bearing the misconduct, but his name had been redacted in every single location. So we didn't even know who this person was at first. So that was the first hurdle. And through date matching, and luckily this was a small department, we were actually able to figure out it was him. And then we just started doing a lot of reporting into his employment history, and started calling and trying to figure out, because this officer in particular had worked at roughly 7 different agencies over his career. And we discovered that not only had he had an agreement in 2019 that buried some allegations that he had embezzled thousands of dollars from his agency, we found out that in 1999, when he was working in Los Angeles for the Department of Public Safety, he had previously been terminated and got an agreement there that covered up issues that he had with dishonesty. And the only way we got access to these records was calling everyone in his life, and through sheer persistence. In particular, one of the sheriffs at his department, where he got his agreement in 2019 related to embezzlement allegations, that sheriff was so scared of speaking, not only because the California Penal Code prohibits police chiefs from speaking about personnel records. They're primarily still confidential in California, but there were specific provisions within this agreement that said he would never disparage this officer and never speak of this misconduct again. These records were locked in a cabinet in his office that only he had a key to. And so when someone like me is calling and saying, what is going on here? He ignored my calls for years. And it wasn't until roughly 8 months before we finally finished, this was a long investigation, that he finally called me back and bravely said, I don't care about the consequences. I am going to speak out regardless. That was what we hit time and time again, because all of these people were speaking to us at no personal gain. They weren't working at their department anymore, but they were working in law enforcement in other communities. And there was harm being done to those communities, and they couldn't keep the secret any longer.
Amazing. AJ, one of the strengths of your work is that you show all of us the people who were ripped off and some of the employees who were doing some of the things that led to that ripping off, and also had great video of some of the people who later ended up indicted. And so it's the perfect example of show and not tell, which is so rare, as all of you know. How do you get so many people to come on camera and show what they've got and be willing to tell you what they know?
I think for a lot of people, they want to make a difference. And if something, especially in this population of people that we were dealing with, which was largely people who were newly sober, newer into their recovery journeys, and a big part of their life evolution is making amends and telling the truth. And that's what I kept hearing over and over is like, I need to tell the truth in my life because I haven't for so long. And the idea that their story and their personal history, which often they'd never share, they don't call it Alcoholics Anonymous for nothing or Addiction Anonymous, but sitting down and sharing their story and knowing it had a chance to make a difference for other people, that other people might get the care that they'd been denied, I think it was a big motivator. And that's what I heard over and over was, if you think my story will make a difference, I'll tell it. And it was the same for victims' families, families that had their loved one murdered because the killer hadn't received the treatment that Medicaid had been billed for. They weren't getting mental health treatment. They weren't getting addiction treatment. And it led to kind of foreseeable outcomes. And they were willing to share details of their story because they wanted it to make a difference for other families.
Jennifer, the work that you did is presented in lots of different formats. There are videos, there are graphics, there are databases, there are words, there are pictures. And I think particularly of one video, which is very horrific, and I'll let you describe what's in it. But I also would like you to talk about how you all use those different formats to bring people in, and in the case of a challenging piece of video, how you think about how presenting it and what the conversation is in the newsroom about showing that to your viewers and readers.
Thanks. So we started on a quest, which was, who are these people who are dying and how many are there and why are they dying? So it started with more of a numbers question, really. And this video that you're describing, Kathleen, is a body camera video that shows a woman who was a teenager and she was burning alive in a car that had been involved in a car chase. It started over a minor infraction, which was one of our major findings, is that most of these car chases start over minor infractions, not violent offenses. And that most of the people dying are bystanders and passengers. So this woman, Alexis, was with her boyfriend, and the boyfriend went through a stoplight, so a traffic infraction. And the Louisville police chased the car, and the car went into a tree, and this woman, Alexis, and her boyfriend died. So the purpose of weaving in video was to both show the human toll and the human emotional truth of the outcomes of these fatal chases, and also the problems with accountability. We looked at how officers are very rarely, we only found 6 cases where they had been criminally charged with using excessive force or breaking their departmental laws or policies, I should say. And in this case, it also conveyed what the officer's mindset and his perspective was as this woman was dying. And she had died in this horrific accident. They were unable to save them because of the explosion, and the car was engulfed in fire. And as her body laid under a tarp, he was just sort of casually talking with his co-officers about what was for dinner. Did you have the lasagna? So it conveyed in a very vivid way sort of that juxtaposition. Innocent people dying over minor infractions. In this case, she was a passenger, and this officer's mindset. They faced very few consequences for breaking the agency's policy, which was only chase over violent felonies. In this case, it was a traffic infraction. And they were held accountable in as much as they didn't turn on their body camera videos. So they were disciplined for that. And they went on, these 2 officers who chased the car went on to win these other awards for, protecting the public and so on. So for us, we wanted to use all of the mediums that were available to us to hold officers accountable. In this case, it helped us create a timeline and, again, demonstrating this person's mindset, and also the horror of someone being burned alive.
It's very hard to see that video.
And you had asked, this other second question about what went into publishing that video. It was after lengthy discussions with the family, this woman's sister and family, about their feelings having this video out there that had never been published before. And with their express permission, we published the video and edited it before publishing it. So it was still horrific and showed her last moments, but in a way that didn't also, I guess, didn't feel like it was exploiting this moment and didn't show these other graphic details.
Thank you. Each of you have to deal with something like this in your work. You're either through data or sourcing or all the other methods that you've described. You want real people to tell the story, but having a reporter bump up against your life isn't always the most fun thing in the world. And I wonder if you could talk about, each of you in some way, how you wrestle with that. It's hard to find the people that you want to talk to, and then what conversations do you have with them about what it's going to be like to be part of this story? Shoshana?
Yeah, I tried to have these conversations as soon as possible, especially with women that I found who went through this experience. Basically that entails kind of telling them early on in our conversations, this is what this process will entail. I'll interview you many, many times. I'll ask some of the same questions again and again. I'll need to review records so that I can look at the evidence behind your case. And you'll be so sick of me by the end, so sick of me. And they're always like, no, no, no. And then they totally are. But yeah, I've really tried to make sure that they're going into this decision to participate in a story with clear eyes about what it will entail. and to give them opportunities to back out or to come to me directly with concerns or reservations that they're having, because there are legitimate concerns and reservations about participating in a story. Stories can have negative impacts on the lives of our sources. So I find that level of transparency, it builds trust, and it ensures that when a source is having a really hard time, like for example, during an interview, during several of the interviews that I did for the story, it was also a radio story. So I was recording the conversations. There were moments when I could just tell that what we were talking about was distressing, causing panic attack, or just causing these women to freeze up. And, because we had this relationship that was based and built on transparency, we could stop. And there are moments during the process where sources, this has happened to me many times before, where sources realize this is actually taking way more out of me than I expected it to. And a lot of times that's when people tend to disappear. And I don't blame anyone for that, because it's a huge imposition to have a reporter in your life. But when you have built that kind of trust and that relationship, people are more likely to talk through their difficulties than just kind of disappear on you. And sometimes that means, okay, well, maybe this person is not right for the story. Maybe this is not the best moment for you to participate in this process.
Christopher, one of the strengths of your work is that balance of this tremendous data work that you described, the whatever size car it was that the dog caught, and with all the human beings who were affected by it. How did you find them, and how did those conversations go? Because as you said, they didn't necessarily know
Yeah,
were
right.
affected.
One of the tricky things from a reporter's point of view of doing an article about insurance companies sneakily, going behind the backs of patients and doctors to add diagnoses to their records is that the people it's happening to are often in the dark about it altogether. And, this could include, diagnoses that were as serious as things like Parkinson's and HIV. So, finding those people at first proved really difficult because hardly any of them understood that their insurer would have any kind of a financial incentive to do that. If they were even aware that like an inaccurate or questionable diagnosis had made it into their records, they would like just write it off as clerical error or something like that. So particularly for the first article we did, it was just brute force was the only way to find these people, where we basically would call just like dozens, hundreds of doctors out in the world and ask, have you gotten one of these, like, any communications from insurers that mentioned, maybe diagnoses you didn't really think your patients had or that you weren't aware your patients had? And did you, look into that in any way? And a lot of them, had that experience, but they basically say like, anything the insurer sends me is little better than kindling. So I, straight to the shredder or whatever. So that was incredibly tedious, and to find like, 4 or 5 examples, it literally took hundreds of calls. And then, I mean, like, this is not as difficult in terms of getting people to kind of be on the record once you found them as some other projects I've worked on, like convincing, victims of sexual abuse to go on the record or something. But it required kind of a high level of documentation. So in addition to finding the people, you had to get them to kind of dig through their own administrative records to find the actual evidence that indeed the insurer had done the thing that we were investigating, and hand it over for us to use. Once we did the first story, though, we sort of unwittingly, had kind of committed this unintended act of service journalism by answering the question that it turned out like thousands of seniors had, which is, why does my insurer like keep spamming me with phone calls to try to get me to let some nurse come to my house, which is one of the main ways they add the diagnoses. And that, generated like an outpouring of people who were writing into us, basically saying like, my insurer said I have COPD, but I jog every day. How can that be? And from there, it was kind of easier to suddenly we had like a big pool of people who were kind of ready and willing to to be, you know, in future articles, now that they understood like why it was that they were getting these, you know, to their minds fabricated diagnoses. And then just like real quick, the other main kind of category of characters in these articles were medical providers who worked often you know, often for the insurers themselves. And it was alarming to me how even former employees of some of these companies were so terrified of speaking because they felt that some of the biggest insurers, I mean, one of these companies has like 30% market share in healthcare, like not just in Medicare, like in healthcare. And you know, the consequence of pissing off that company, if you're like a doctor or something, might mean that you're basically unhireable because they won't let you be in their insurance network, like what hospital or medical group or whatever is going to want you to be a part of it. So that was kind of a different challenge, but probably typical of, you know, investigating really any kind of huge corporation.
Katie, that kind of personal risk you already described a little bit in the case that you gave us, but how many times did you encounter people for whom talking to you was going to be potentially career ending, and how did you talk them into talking to you?
I mean, every single officer that we looked into. I mentioned there were 163 departments, but we identified 300 officers who had these types of agreements. And they had been hired from various agencies and had these agreements. And so every single one of these had confidentiality provisions that prevented them from talking and preventing them from speaking with us. And they were all aware of the Peace Officers Bill of Rights, which protects law enforcement privacy more so. And they were also aware that these officers have robust legal defense funds with basically unlimited spending on attorneys who would file on their behalf if they release some of this information. How did I get them to speak with me? I spent a lot of time, and my reporting partner, Casey, and I spent a lot of time really understanding their risks. And I think that really helped them know that we knew what we were asking of them. And building that trust with those people to say, okay, we know what you're risking to do this, and you're still willing to. And I think that really convinced a lot of them to speak up. But I think the other thing that helped was we made a lot of calls and a lot of asks and got hung up on, obviously, many times. Because when it's something like that that's so difficult to speak about and comes at such a personal risk, I think you need to cast a wider net to try to get some of those people to talk about it.
Just a quick follow-up. Did it help to say that others had talked to you, or was that not something you would do?
That is something I would do. I don't think that necessarily helped them really feel confident because no matter if someone else had spoken to me, that's still like they were still taking the risk personally.
Right.
And so they were very hesitant to do that because, and some of them even thought, tell me exactly when you're going to publish because I want to get my attorneys ready. And that was the reality of it for them.
AJ, some of the people you interviewed on camera were describing and showing you some of the things that they were doing that were criminal offenses. And I appreciate the atonement part of some of their motivation. But has anything happened to any of them? Have any of them gotten in trouble?
Nothing has happened with our whistleblowers who came forward. Most of the whistleblowers we ended up with were after we aired our first report, which took 6-7 months to finally find somebody to talk with us. And it was a lot of work on the front end. And we like to do what we call pull the string investigations. Once you have a good finding and once you have enough, get a report out there because then the floodgates open. And a year and a half later, I can't open my email without having endless contacts coming in now willing to help out. And that was how we ended up with many of the whistleblowers who saw our first reporting, saw how we handled it, saw how we treated other people, and were then willing to take the risk of talking with us. And being a TV station, we have the added challenge of when we do an interview with someone, where you're sitting down on camera and your face is out there and you're not just a name that's out there. People are going to know who you are. And that's a lot of conversations like some of the other panelists have talked about too, of meetings and for coffee and for chatting it through. And in some cases we've even had, whistleblower say, will you meet with me and my mom? Can you explain to her what you're asking for? And so it's taking a lot of time to find them. And then for people who were doing things that were appeared to be wrong, sometimes I was just amazed that some people talked with us in ways that nobody's talking with us right now after multiple organizations have been shuttered. But I think just being transparent to is like, look, this is what I have. And we often tell them upfront, like, I'm looking at this, here's what we have, explain it to me. And that was kind of our process, but it really like pulled the string on a lot of these stories of the floodgates opened once we got that first report out there. That took forever to get to that point.
So often true, though, the first one. Jennifer, can you talk a little bit about, you were describing some sensitivity around that particular video, but there were probably many occasions where you needed to be talking to people whose lives had already been impacted by the crash, and you were about to impact it again. How did you have those conversations?
Let's see. We approached people whose cases stood out in the data. Some cases, the victims were very young. So those ones immediately stood apart. And then through litigation, we found other families who represented the major findings that we were looking at. The lack of accountability, the people dying over minor infractions. Nearly a third of those who died were Black. So there were some definite major findings. And we approached those people to describe what we were doing. And in sort of developing a rapport with them, we established shared goals, if you will. And our goal was to bring to light not only how many people were dying, but who and if people were being held accountable. And I feel like that motivated a lot of families and helped them feel more open to the process of discussing these very personal and traumatic stories with us. We also, we do things like during the interview process, we ask open-ended questions. We stop from time to time, as Shoshana was mentioning. AJ, you mentioned a mother. Well, that resonates. Definitely had a mother and a lawyer on the call with a woman who was the sole survivor in her family. The rest of her family had been wiped out in a police pursuit. And we looked at all of the material so that we knew a lot about these cases going into these interviews. And it helped us sort of establish that trust with these people who are opening these, intimate details to us and reliving those experiences. And then, after the interviews, following up and checking our facts with them, and also ensuring that they knew what would be in the stories, that there are no surprises, and they knew the context in the story and so on. So for us, we view it as long-term working relationships with these families, and then the videos and so on, the photos. We have a long conversation with the families to get their permission and to get a sense of how comfortable they would feel with those videos being out there.
Well, you have a long-term relationship with people in the military, Dave, for good and for ill, I suspect. But you did describe some mindsets that I'd be interested in hearing how you overcame them. They wouldn't lie to me. I don't think this, I can take care of myself. I'm worried about my brother, don't coddle me. I'm going to handle this on my own. How did you break through that?
Yeah, AJ said something that really resonated with me is that like a lot of the people he spoke to were motivated by altruism. So people in uniform, for them, like the media, register is probably a step or two below the Taliban in terms of people they'd like to talk to. They're told not to talk to us. They don't like us. They don't trust us. Also, they're different from pretty much everybody that has been described by other panelists because they expect to, they have a reasonable expectation to be harmed in their work. They volunteer knowing that. They make this sacrificial move. And so they're a different group of people from the rest of the population in general. And so if I went up to them and I focused on some harm that had been done to them and how I wanted to understand it and explain it to people and say, like, isn't this a travesty? They'd say, you know what, fuck you. And so that won't work. But they are extremely motivated by the love that they have for the people that they serve with. Literally, they would take a bullet for them. And that's not a cliche. And so when I approach them, I say, hey, I think this is going on. And you can help me help the other guys in your platoon. I can go to a SEAL and say, like, hey, David died. And I think he died because of this. And no one's talking about it. And, David was in your platoon. Help me tell this story. It's your story, it's his story, but it will help all the other SEAL platoons. Will you do that for me? And I got to tell you, the answer oftentimes, probably more than 50% of the time, is still fuck you. However, I increase my my success by just like understanding their motivations and meeting them where they can feel useful. And so like over and over again, I just say like, help me help the other folks. Let's do this together. And they do.
I want to ask two questions of all of you, and it has to do with what has happened since your work was published. And in some of the contest entries you described, active vows of, vows to fix things. But I'm interested, so we want to hear about that, but I also want to hear about what your audiences did in response and what you heard from your audiences, which is, of course, the reason we do this, is to reach people. So we can just go down the line if you want, or I can call on you, girl, boy, girl, boy. Jennifer, why don't you start?
Our impact has been legislative and policy changes. So members of Congress wrote to the Department of Justice and other federal agencies demanding better data. The NHTSA, before the articles were published, agreed that their data was flawed and that they would update it.
Explain what NHTSA is.
Oh, yes, the National Highway Traffic and Safety Administration. And we also saw some advocacy efforts. The policing project at NYU developed a model national policy for state lawmakers to adopt in every state to restrict pursuits to violent felonies and other serious matters. And there's some pending state legislation in Hawaii to restrict pursuits that was nudged along by our reporting. And I guess, dozens of media outlets also use the data, which was open source, and published their own articles. There was also an article in JAMA. And so those are some of the impacts.
And your audiences, how did they respond?
They were overwhelmingly supportive, and there were many cases where fatal pursuits where people came forward to describe their experiences, and I was overwhelmed.
Let's just go down the line. Katie, why don't you go next?
Yeah, so the impact with this story, there has been a bill introduced in the California legislature that would ban the use of these agreements in the state of California. There have been similar bills in other states because these agreements exist in other states besides California, but California's law as proposed is quite strong. The ACLU has also taken up the charge and is pursuing and planning to pursue suing several of the largest agencies in the state who have refused to give us any of their agreements, despite having teams of people who work on these types of agreements. And in terms of the community response to this. I think one of the surprising things that I found was the response from law enforcement, police chiefs, sheriffs across the state, background investigators who were thanking me for exposing a problem that was so widespread. They knew it existed, but they didn't know how often it was happening, and in what regard some of these terms buried some of this misconduct. So it makes their jobs of hiring easier to know that that's something that they should be requesting in every single background check. And additionally, when we published this story, we also published all the departments who weren't releasing these records and the departments who did. And so it really launched a variety of local reporters to request those agreements and to challenge their own agencies in their communities to get access to these agreements and do their own reporting. I think in San Diego, one reporting story in particular, an officer lost their job. And it was not an officer that I had reported on or named in the story because of their reporting after getting access to these agreements in our data.
Great.
Yeah, so the Inspector General of the Federal Health Department, after our reporting on the topic, recommended that Medicare stop paying for one of the main sources of what we've called insurer-driven diagnoses, basically the home visits by nurses. The idea would be that they cut off any additional incremental payments for diagnoses that come just from that source. I haven't really talked about this part of our project during this panel yet, but one of our articles also looked at the way that United Health in particular employs medical doctors and suggests to them and encourages them to adopt various diagnoses for the patients that they treat in a way that results in a much higher disease burden for their patients. And a bunch of the doctors we interviewed for that article were subsequently interviewed by attorneys for the Justice Department Civil Division's fraud section. And we were able to confirm that DOJ had launched an investigation looking at kind of the Medicare Advantage practices, including specifically that one, United Health. And where that goes is too early days to say, but and then in addition to that, Senator Grassley and some other lawmakers have requested a variety of documents. Senator Grassley asked United Health to turn over years worth of audits of its diagnoses and manuals for how it encourages providers to add them and things like that, citing our findings. And I think most interestingly, the new nominee to lead Medicare is Trump's choice to lead Medicare is Dr. Oz of TV fame, and he was looked at by Wall Street as like a great omen for Medicare Advantage companies because he had in the past proposed, among other things, Medicare Advantage for all. So that he was thought to be quite friendly to the industry and would be like a reprieve from relatively more harsher Biden administration policies. But during his confirmation hearing, he was questioned about our findings, sometimes in very specific detail by the senators, and responded basically that he agreed it was abuse, in some cases fraud, and that as Medicare director he would crack down. Again, we'll see if that happens, but it was it really highlighted, I think, the tension going into this administration over wanting to privatize stuff, including Medicare, and then on the flip side of that, wanting to spend less money. So we'll see where that balance winds up.
Do I recall reading that the Congressional Budget Office said just ending the home visit diagnostics that you were describing would save $124 billion?
Yes, but to clarify, that was ending the home visit diagnoses and basically basing payments on 2 years worth of diagnoses rather than just one, which interacts with how the payments are calculated in a too complicated way to explain right now.
It's a nice number to contemplate, though, saving $124 billion over 10 years. Shoshana?
I'm told that federal bipartisan legislation is in the works for this session to address the laws that kind of are the source of some of these issues. Also, I've heard from doctors who are using our stories to kind of go to their institutions and try to push for change to their drug testing and reporting policies. There are a couple large civil rights groups that have hired attorneys and are pulling together teams to try to push for legislative change in certain states and to potentially pursue litigation on behalf of some patients who've been drug tested and reported without their consent. And I guess most importantly, I think, or one of the most important pieces for me after these stories came out is just hearing from women all over the country who experienced this and thought that they were completely alone. There have been a couple of women who emailed me to say that this happened to them decades ago. And I think because of the shame involved in being identified as an alleged drug user who exposed your baby to harmful substances, this is just not something that had been talked about or addressed or challenged in any way. So several of those women have told me that they are wanting to do something about this. There was a petition that circulated calling on Kaiser Permanente to change their drug testing policy. And a couple of those women filed civil rights complaints in their states.
So AJ, everything is been cleaned up in Minnesota since you're reporting, and all is good?
My last story last week was still dealing on this, and we're about 2 years in, and I'm losing track to the ones in the future that are still coming. So, but there has been a lot of reforms, a lot of fallout from our reporting. There's been legislative reforms. Addiction is something that impacts so many families in America. And it doesn't matter if you're on the left or the right or the color of your skin or who you sleep with at night. Like, every family is somehow touched by addiction. And so we had a lot of bipartisan buy-in on some of the reforms that were needed, and several passed last year. And I'm losing track of how many different bills have been introduced in our current legislative session. I'm like 8, 9, 10. It's somewhere in there that deal directly with our reporting. There's been 2 FBI raids at this point. There's been 3 people have been indicted, and there is multiple ongoing federal DOJ, state attorney general investigations that are still underway. So there's been kind of this wide-ranging reform / impact. So there's just a lot of moving parts and still ongoing into the future. It's touched, I think, a lot of nerves.
And just right quick, your audiences, how did they respond besides sending you a lot of emails?
I think I kind of touched on how they responded by just saying, like, this impacts so many families. And so I really got a lot of, from our general audience, was a lot of thank you. You know, no one likes fraud. And when you're exposing tens of millions of dollars of fraud, you get a certain subset of people that are very great job, and others, and then you're also dealing with real people. Right. You had people that needed help that were not getting it and were being exploited. And by and large, I think we were able to tell stories in an empathetic and compassionate way, and the human stories that needed to be told. And I think we did a good job with that. And it made, for the audience, easy to understand. They could see that happening to someone they love.
So Dave, the promises of reform come from a bureaucracy that is not known for its speed?
True. Well, it depends. The pointy side of the military is very efficient, and the tail side less so. Fortunately, helping veterans not harm themselves by shooting their own weapons is not a partisan issue. So we were able to get reform through Congress. There's probably more coming, where in the future, people will be tracked with how much blast they're exposed to. It'll go into their records. It can be limited. There's new funding for research. And for the first time, there's actually a diagnosis, so that when you go in, the doctor will no longer say, well, you can't have a brain injury. There was never any trauma. But what else is interesting, and one thing that really resonated with me that you said is, like, someone said, I thought I was alone and I wasn't. So what we're all doing totally different stuff, but we're all doing the same thing. Is we're painstakingly drawing you a picture of what's going on so that you know what it looks like. And once you know what it looks like, You see it everywhere. Like now I walk around, I'm like, oh yeah, repetitive head injury. Yep, I see it. I now know what it is. I know what you're experiencing. But imagine the wife who her husband been flying F-18 Hornets for 20 years and he seemed like he could do anything and now he can't pack his backpack and he just punched you in the face and you don't know what's going on. And now you see it and you know that it's not your fault and it's not his fault and there's a way to help. And also at what the Navy calls the deck plate, which is down where like the real people do the real work. Our reporting reaches down to the deck plate. They read it. And to your point, the bureaucracy is pretty stupid, but the people on the deck plate are actually pretty smart and they can figure out, okay, how do we mitigate this? We still got a job to do, but how do we do this in ways where no one's going to end up after 15 years not able to sleep anymore? So that's happening.
That's great.
So let's open to questions from here and also when we get some from the Zoom. Please wait for a mic. Oh, all right, you'll be next. And
Thank you very much. What about the other side of the coin? The insurance company denial. That's question one. Question two is how does the murder of the CEO and coach slashing her?
Yeah, so on question, to start with question number one, we had access to this great trove of data that showed all the stuff that happened. It didn't show the stuff that didn't happen, the stuff people wanted but that got denied and the service never took place, which is really unfortunate because that would be great to have the same level of detailed insight into. So we did examine those issues though through a somewhat roundabout way. I described it as we were talking, planning the story as like a negative image of the denials, which was we went and found people who dropped out of Medicare Advantage altogether and looked at what was going on with them and what happened to them when they went back into regular Medicare. And the revelation was that people were leaving at twice the rate in the last year of their lives compared to during other phases of life, which is the group, of course, that is using healthcare services the most intensively. And then the kind of most amazing stat was that those people, once they dropped out, within a week of making that pretty significant decision, a fifth, they were using nursing home services, which is one of the most expensive things you can do in Medicare, at like 5 times the rate of other end of life people. So what we saw was that people were dumping their Medicare Advantage insurers and seeking the most expensive, some of the most expensive care possible at like extraordinarily higher rates than normal people, even for their same, for their same phase of life. And it was just a way to show that while on the front end, the incentives are to generate, huge amounts of revenue and take a skim off of it, on the back end, the incentives are to not give people the care that they need because it costs money. On the second question, our reporting didn't have a lot to do. I mean, it's hard to untangle these issues because I think that the episode, the reaction to the shooting of the United executive, belied in a surprisingly broad segment of the population and an incredible frustration with the way healthcare is sort of paid for and divvied out and bureaucratized. But the actual, the shooting itself didn't have a lot to do with what we were reporting about. It definitely made interactions with United Health Group in particular like incredibly more painful. And at one point I sent them, I tried to call and reach somebody, didn't get any answer, and had to send a bunch of questions for an article. And they wrote back, basically that they couldn't possibly devote resources to responding to those questions at that moment. And they were frankly shocked that I would ask. And we thought about it for a little while and responded to say, basically, you guys are the steward of more than $100 billion in taxpayer money every year. And, I'm really sorry for what happened, but we have to ask these questions and, let us know if you want to answer. So that was that. And with Doge, I don't even know what to say about Doge. I think I think that I think that, in Medicare right now, DOJ is clearly active. And, we did a recent article where we asked Medicare a bunch of questions and expected the kind of normal, detailed sort of, bureaucraties response that we get. And instead we basically heard back from DOJ saying like, oh, that's a great example of fraud. but what that means for the future, I can't, it's hard to say.
Thank you all. Great work. I wish all of you could win. My question is actually for all of you. Every one of you spoke about the personal risk that some of your sources took. The elephant in the room is the elephant, pun intended. And in future investigations, some of you may be at risk yourselves. What do you think about that?
Well, what do you think? Anybody?
I'll start. I think if a source is willing to put themselves at risk, I'm willing to do something similar. I think this work is incredibly important, and I'm so inspired by hearing all of them speak today. And it inspires me to do more of this kind of work, no matter what the consequences are. I don't these sources talk to us, in my case, facing serious repercussions of losing their jobs, and lots of money. And I feel like I would risk the same.
I think with our reporting, we had a bunch of threats legally. I mean, it's a little bit of hyperbole, but you could almost wallpaper our office with these cease and desist letters that we were receiving from pretty powerful law firms. And having kind of management looped in ahead of time, they knew what we were doing, and being very documented and factual with what we were reporting, we had backing from management to just push back on these threats. I think that was really key, to have institutional backing for the journalism team to say, no, we're going to hire lawyers to support you when you're faced with these threats. It's a little different than what you're asking, but I mean, in some ways the answer is the same.
Yeah, I think it's really important to underscore that, these folks represent both the teammates on their work, but also the organizations that commit to this kind of work. As you've heard, it's very painstaking. It takes a long time. And the legal fees just to, kick the tires in addition to anticipate what might happen are not insubstantial. And I was going to say this for the last, but this is a good moment to say, if you aren't paying for journalism, start. You pay your cable bill, you pay your phone bill, and that transmits information to you, but pay for news organizations that do this kind of work. That's the thing that will keep it going. Now, we're ready for other questions.
Thank you. Yeah, I'm Joel Gurr, and I run a small nonprofit in DC that works on the use of public data for public good. I also want to congratulate all of you for just incredible work. And I'm struck, especially with the Medicare story, but with, a lot of your work as well, on the reliance on being able to find data that you can analyze to find patterns and, really make change. Without going into detail, because we could talk about this for an hour. I think, everybody's aware of what's happening in federal agencies now in terms of taking down websites, taking down data. a lot of concern that this is going to relate also to future data collections, whether it's removing data on race and ethnicity or gender identity, or whether it's simply, stopping data collections
Sorry to
altogether.
interrupt. Can we get to a question?
Yeah, there is a question in here. I apologize. Okay, I'm sorry. My question is: are you concerned about the availability of future data, either at a federal level or state or local level? Are there trends that you've seen, and have you thought about ways to address those?
I can't say that I think at least the federal government has ever been great at making data available reliably, and just to be able to use the data, that I've been talking about today in the way that we have for this, and in a kind of more scaled back, less identifiable version, a decade ago about Medicare. It's like we had to litigate that issue, in court, in federal court, to be able to like write about doctors by name and stuff. So it's not like, like past administrations have been, real helpful. I mean, yeah, I was worried about it in the last administration too. I mean, I don't think the governments like to make it easy to pick apart, their operations and find flaws in their policy, ever. I think that, that the decisions about that are getting more arbitrary in this administration, and that the capacity to change it more drastically is like way amped up. But it's also like, I don't know, like just yesterday, for instance, we had a change to our current data use agreement to access this stuff, approved, that expanded what we have in a significant way. So it's not, it's not affected. I haven't really seen it affect me like quite yet, but yeah, I mean, I recognize that potential for sure.
For questions? We got one up here and one back here.
Hi, this is Emily from the Shorenstein Center. Thank you all so much for your really impressive and important work. AJ, you mentioned the importance of having the backing of your leadership team, which just makes me wonder, this is a question to any of you, what are the workplace conditions or values or support systems that allow you to produce this kind of important but extremely costly and intensive reporting?
Tell stories that matter and hold power to account. I think, that's what our team has been tasked with, just like that fundamental bedrock of journalism. And I feel very fortunate and blessed to work at a place that supports that. And like you said, it's expensive and it's time consuming, but I mean, to date, we have had the backing to go do that sort of work.
We had somebody up here.
I wanted to thank all of you for digging in and explaining about empathy and trust and tenacity, because I was going to ask you in the beginning, I was thinking of questions I would ask, and I was going to say, well, what do you tell young people in the field? But you answered so many of my questions, explaining how you built trust. I was amazed. You let the mother in too. You do all these things. You figured out about the brothers. I don't know how you did that. I mean, it's not obvious. I guess that's one question I have. And I guess that's pretty much it. Thanking you guys. And and I wanted to just tell you, Christopher, that in terms of the regular audience, regular people were passing your article around like crazy, who are trying to decide whether or not to go on Medicare Advantage or Medicare Traditional. And your article was like the linchpin for people who are on the fence to not do Advantage, widely circulated. And so anyway, thank you for all that all of you have done. But I would love to hear how David figured that out.
By screwing up over and over for years until I was like, oh, this worked, which I think is probably like describes my technique in general in terms of how I do journalism. But the other thing that got mentioned here in a couple different ways, and we all have a different name for it, but it really works, is what I've always called the open for business story. And what did you call it?
I'm pulling the string.
The pulling the string.
Yeah.
So like, you have all these sources out there that you don't know that they exist, and they don't know you exist. And if instead of doing like a 18-month like investigation, you can put something out quick that says, oh, by the way, they'll come to you. They've been waiting for you. And so, like, I didn't learn that for a long time. Can I tell a quick anecdote about how that works? So I finally learned that when I was like 45, and I was like, yes, I'm going to do that. And I put out a story that was just a short little daily story that said, oh, the Inspector General of the Pentagon is looking at whether the Navy SEALs and other special forces have followed the rules of engagement when they're in Afghanistan. And I knew that they had not followed those, but I didn't know who might tell that story. So I was like, I'm going to put out this open for business story, and they're going to come to me, all those Navy SEALs they've just been dying to tell me something. And not a single Navy SEAL, not one came to me. But about 3 months later, a guy who'd been in the sort of command center of all the airstrikes in Syria came to me and said, we're not following the rules of engagement. Let me tell you all about it. And that became like some Pulitzer Prize winning work. So like sometimes those stories, you just throw them out there and you don't even catch what you think you're fishing for, but they really work.
We have time for one more question. Do we have any from? Okay, great. Let's take a Zoom question.
All right, this is a question from the Zoom audience, which is just sort of to follow on that point. What are you all working on next that you can share?
The exact same thing. And we've been going from one Medicaid program in the addiction recovery space to another. And you can almost go get the data set, start looking at who's billing the most and how long they've been around. And if they're new on the block and they're billing more than everybody else, you know where to investigate. And that's what we're continuing to do, is continuing to pull that string and follow the money. And we've got some more pretty bombshell stuff coming in a few weeks, I hope.
Just come on down this way, one by one. Why don't you? Shoshana, do you want to talk about what you're working on?
Well, we just published a story yesterday about hospitals that have changed their drug testing policies, and many that are also working on it. And now I'm kind of looking at the implications of these types of cases in states that involve law enforcement or criminal charges in some way. There are some states that do charge women criminally for using substances during pregnancy. So that's something that I'm examining pretty closely.
Are we going this way?
Oh, either way.
AJ had mentioned, going down the list with Medicaid. The Medicaid is suddenly interested in lots of different ways. For one thing, it might be on the chopping block soon. We have access to detailed patient level data in Medicaid as well. And we did an article looking at, perhaps you could call it an open for business article, looking at the role of insurance, the same insurance companies basically in Medicaid too. They oversee benefits for about 70% of people in that program. And we published an article a couple of weeks ago looking at the way that they oftentimes get payments for the same person in more than one state, because people move and stuff, and don't mention it to the Medicaid program because the system is set up to rely on people who are eligible for Medicaid to like report if they move, so they can turn off their benefits before new benefits start someplace else. So what we found was that the program was spending like $4.5 billion over a 3-year period on not paying for the same people twice, but just on the wasteful payments from in the states they no longer live in. And at a moment when when Congress is talking about cutting funding for an already pretty threadbare benefit program, the fact that that kind of money is being wastefully paid out to giant insurance companies seemed kind of particularly irritating. And I think there's more interesting work both on the kind of financial side and also on just frankly like the equity and the kind of on the human side of Medicaid that we might want to explore.
Great. Katie?
Yes, I'm working on something a little different. And you talk about building databases and how it's hard to get access to databases. So I'm working with data scientists right now to build together a database of all police misconduct and use of force cases in the state of California that are disclosable. At present, we have almost 20 terabytes of data, and we've identified more than 9,000 cases and are planning to publish these cases and extracted information from them using AI to do that. in the next couple of months, and also give access to people, victims of police violence and police misconduct, to have access to all the records related to those incidents.
Jennifer?
I've pitched my editors on a new project, and hopefully they're considering it seriously. And it touches on public health, public safety, sentencing disparities. So it's sort of cross-disciplinary, and I'm excited about a new project.
Well, we'll keep our ears posted. Dave, any open for business stories coming?
Not yet.
Okay. All right. Well, we're going to wrap up just a few minutes early. I want to thank you all for coming, and to those of you on the Zoom for participating. And I have a job for you. In addition to paying for journalism, I want you to become the evangelists for this kind of work. The next time you're in a conversation when somebody's honking on about the media, you explain to them what it takes and what these folks do to bring truth to readers. And it ain't like the movies, and it ain't like talk radio, and it ain't like the chat shows. It's hard work with deeply committed people, ethical, committed people doing that kind of work. And support it both with your dollars and with your advocacy and your public support of it. If you don't think journalism makes a difference, these folks should persuade you otherwise, and always will. Thank you very much for coming, and congratulations to the 6 finalists for the Goldsmith Prize for Investigative Reporting.